Studying as a nursing student can be so hectic sometimes, and with effective strategies, you can manage it, and it can be so effective when you follow those strategies or when you put those strategies in place or make good use of those strategies. So here are some of the strategies that I'm going to highlight to help you make your studies as a nursing student so simple, so that you don't get a lot of soup. We said as a nursing student you're not supposed to get supplementary. Reason, you will take a lot of time concentrating on doing so many supplementaries, and they will disorganize you. They will not make your life easy in nursing school. So guys, if you've not subscribed, subscribe, like the video, share, comment. Don't forget to turn the notification bell so that every time I post a video, you will be the first person to be notified. So guys, we have some of these strategies that we are going to highlight. This hack will help you do your studies in nursing school without any problem. So guys, hack number 1 is active learning technique. Hack number 2 is smart study method. We are going to look at that. Hack number 3 is focusing on high yield information. Hack number 4, clinical and lab study hack. We are going to look at that. Also, we are going to look at some of the things that you can. Okay, another hack is about staying organized and also taking care of yourself. Yeah. So those are some of the hacks that we are going to talk about. When we talk about hack number 1, which is active learning technique, this involves teaching someone where you can go and read something. You go read something, you understand, and then you come and teach your colleague, or you come and teach your classmate. Yeah, that is about. So you get that when you are teaching someone, you are getting to you are understanding it better. Yeah, you are understanding it better. Another hack that I'm going to that you're supposed to use in active learning is about the acronyms and mnemonic. These are just formulas or words that are made easy for a nursing student to remember some of the difficult scenarios, difficult what condition. Yeah, some of they can help you understand the condition, or they help understand a concept. Yeah, use of mnemonic and acronyms. Yeah. Another hack in active learning is quick flashcard. This one you can use maybe use app like Anki or quick quiz for key terms. Also, you can get involved. You can involve yourself in answering questions that have been answered by, or questions that were done with or by the previous student or students that were before you. So that is all about active learning. When we talk about a smart study method, you have to know that you have to put some of you can know, get your timetable. You know when to read what, when to read this, and when to read that. Yeah, you have a timetable. You attend record lectures and you listen to them later. Also, you can summarize a concept in your own words so that you get to understand. Yeah. Also, another thing is that is about focusing on high information, whereby you prioritize on your weak areas. Yeah, you prioritize on your weak area. You get that maybe if you are weak in pharmacology, that is where you get focus. You know, in nursing, you get that some units are so easy, even if you read like just one sitting, or maybe when the lecturer is doing his oral lecture, you can grab the concept, and that is how it sticks. And you get that some units that you have to sit down, go read. You get into groups, you read. So you, under this, where you can you focus on high information, you prioritize where you are weak. If you realize that you are weak in pharmacology, that is where you focus in. You spend a lot of time studying that, and you get the concept. If you realize that it is midwifery is what you cannot understand, then that is where you prioritize. You get into groups, you discuss about it, you get questions, you do everything possible for you to get to understand the topic or this unit that you are not getting. Also, another thing that you can involve in is about clinical and lab study act, where you can go to the lab, do an experiment, and that is how that concept will stick. Or when you are in clinic, or when you are in clinical area, you can find a condition and you manage that condition, the real condition. For example, management of malaria, or maybe let's say management of pneumonia, malaria, or any other condition. So when you are in clinicals and you see the way that condition is managed in the clinical area, that is the same way it is managed in books. So that is how you get to understand some of these conditions. You find a condition that you did not get in class, you focus on it when you are in clinical area. Another thing that you have to focus in, or another hack, is about staying organized and avoid cramming. Please, we said you should not cram. You get to understand, you read to understand, you learn to understand, you grasp the concept, you get the concept into your system. So you avoid, as much as possible, you avoid cramming, because you know, if you cram, then it will reach a point that they will go away. They will just disappear from your memory. So avoid cramming. Use a planner. Review daily. Don't cram. Go get into groups. Discuss that concept that you are not understanding, and then you will understand it. And then the last one, taking care of yourself. This involves Some of you or some of the students, when they get into nursing school, they forget about sleep, they forget about taking a bath, they forget about even doing exercise and focusing on maybe their hobbies. When you are in nursing school, it doesn't mean that it is death or death. You also have a life to focus on or to attend to. So make sure you take care of yourself. Sleep enough, do exercise, eat well, and then engage in other activities. That way, you will get to grasp the concept, whether you are in clinical area, whether you are in class, those theories that are you cannot get them, that you're not able to understand. When you engage in other life activities, you will get to understand them. So bye. If you've not subscribed to this channel, make sure you subscribe. We are going to talk about nursing, we are going to talk about medical conditions, we are going to talk about things related to life, things related to anything that can bring positive impact into your life. So make sure you subscribe, like the video, share, comment. Tell me in the comment section which condition do you want me to talk about, or what do you want me to talk about. Yeah.